Welcome to today's broadcast. My name is Colleen Patterson, and I'm the Director of Employer Services and Compliance at Savoy. It feels great to be back around the table and sharing information with all of you, our partners. During the beginning of the pandemic, we spent countless hours discussing the Coronavirus Aid, Relief, and Economic Securities Act, or as we've all known, the CARES Act, which was actually signed into law on March 27th. And boy, does that seem like a lifetime ago as we're sitting here in October looking back over the last 7 months. As we know, the CARES Act included one-time payments to individuals, it strengthened unemployment insurance, and it provided additional healthcare funding as well as loans and grants to businesses to deter layoffs. But these sweeping measures also altered the rules for employee benefits, affecting health coverage and retirement savings, among so many other things. It's no secret that COVID-19 is still disrupting employer and employee operations across the country. The extraordinary challenges and questions posed by COVID-19 has definitely created a storm of emotion and confusion around health coverage. U.S. workers have faced reduced hours, layoffs, and in many cases, termination due to the coronavirus pandemic. And adding to the mix of all of that, the Family First Coronavirus Response Act, or FFCRA, as we know that, ushered in new sick leave and FMLA requirements as a result of COVID-19. With all of these challenges employers are facing as a result of the pandemic, ACA tracking and reporting is adding to the confusion, creating an extremely long list of questions. As we near the next ACA Employer Shared Responsibility reporting season, we are here to answer your questions and provide clarity around how COVID-19 has impacted reporting this year. Today, we are focusing on the reporting season. To address these questions, I'm joined by Sarah Simpkins, who is an employer services specialist and member of my team here at Savoy. Sarah and I spent a fair amount of time discussing how the events over the past 7 months will impact applicable large employers this reporting season. Sometimes I feel like there's nothing else to talk about except this. So due to the COVID-19, as we know, the federal government issued the Family First Coronavirus Response Act, which again is the FFCRA, and that was to assist employees in companies with fewer than 500 employees with time off to care for themselves or family members that were impacted by the coronavirus issues. The leave actually is effective from April 1st through December 31st, 2020. Sarah, as it relates to ACA reporting, what should employers know about the coronavirus sick leave relief for employees?
Well, employers should definitely be aware that paid sick leave covers up to 80 hours for full-time employees that are unable to work or telework due to their own quarantine or coronavirus illness, which here means either coronavirus symptoms or an actual medical diagnosis. So during these 80 hours of leave, they'll be paid at their regular rate of pay. And if the employee needs leave because they are unable to work or telework while the employee cares for an individual in quarantine, or care for a child whose school or child care provider is closed for reasons related to COVID-19, then the full-time employee receives two-thirds of their regular rate of pay during their leave. For part-time employees, there's also a calculation based on your average hours worked to find out how many hours you will receive under the leave laws. So what does that all mean for ACA reporting? Employers should keep in mind that FFCRA-related leave should be counted toward hours of service for ACA tracking purposes.
Great, thanks, Sarah. So during this uncertain time due to COVID-19, many employers are wondering if they are required by the ACA to continue offering coverage while employees are not working. Sarah, would you address whether or not the IRS has changed any of the ACA related requirements due to the coronavirus?
Well, employers who formally terminate their employees do not have an obligation to continue coverage past their date of termination. However, employers who have furloughed or laid off employees without termination or transitioning employees to some type of unpaid status need to ensure that they are in compliance with the ACA employer mandate to avoid penalties under the ACA. The penalties for employers who do not offer health coverage to the people they should be can be quite severe. It's important to remember that if an employee is, for an example, in a stability period prior to their furlough, the employee is still full-time even though they're working 0 hours, and therefore are still entitled to coverage for the duration of the stability period. So, in order for employers to avoid possible exposure to the ACA's hefty sledgehammer penalty, Penalty A, they need to ensure that offers of health coverage for all ACA full-time employees are extended during furloughs or any extended leave. Employers should also be aware that there is potential exposure to the ACA's Penalty B if they resort to offering COBRA to full-time employees during a furlough or extended leave. And this is because the employee bears 100% of the cost for COBRA coverage, which would make the coverage unaffordable under the ACA. Penalty B would be triggered if that full-time employee waived COBRA, then obtains a subsidy on the ACA exchange. Employers would also need to ensure that they are reporting offers of COBRA correctly when filing 1095-C forms with the IRS.
Great. Thank you so much. So, I mean, one thing's for sure, as Sarah's been talking about these things, there's a lot of moving parts. So, as she was talking about part-time and full-time employees, what happens then, Sarah, when employees return to work from these layoffs, furloughs, or even an extended leave?
Employees who are laid off, furloughed without pay, terminated, or otherwise on extended leave, who therefore have no credited hours of service during the coronavirus outbreak, are subject to the ACA's break-in service rules. The IRS has their own guidance for how to handle employees in these situations. The rule of parity in particular sets forth guidelines for how long an employee can be absent from work, return, and still be considered eligible based on previous service, as opposed to being treated as a new hire. The IRS rules have two parts, and they really can be summed up as the following. First, there's the 13-week rule. If an employee returns to work after a period of 13 weeks with no credited hours of service, they can be treated as a new hire. So, although a furloughed employee should be offered coverage during a furlough, they can be treated as a new employee, and the waiting period can restart if they return to work after at least 13 weeks of unpaid leave. Next, there's the rule of parity. An employee can be treated as a new hire upon their return to work if they were on a service break of 4 weeks or more with no credited service hours, and the duration of the service break was longer than their period of employment prior to the break.
Thank you so much, Sarah, for providing clarity around the reporting issues that employers are facing. Because reporting is sure to be more confusing this year than in years past, Sarah will be hosting several ACA employer shared responsibility reporting webinars and virtual workshops. They are scheduled for Thursday, November 5th, and that will be a virtual workshop. Wednesday, November 18th, and that's going to be a webinar that will include a deep dive into the ACA reporting. And Thursday, November 19th will also be a virtual workshop on how to complete the forms. So be sure to register. At the end of today's broadcast, we invite you to complete a short survey. You can find the link to the survey in the video description below. For participating in the survey, you will receive a guide to a ACA reporting that can be used to help navigate employers through the reporting process. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use the resources that are available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.